Share the screen. All right, everyone. Well, welcome to our presentation today, and thank you, Alistair Strong, for having me speak to your crew. So I'm Dr. Michael Twyman. I'm a biohacker. I'll explain what that means in a minute, but I'm a heart attack prevention expert in my day job. So this is me in 2017 on my journey to Bhutan. This is the Tiger's Nest. It's a very interesting monastery on the side of a cliff, but this trip was kind of my intro into biohacking. I had to try to figure out how to beat the jet lag getting over there. So today, that kind of plays into our topic at hand. It's circadian rhythm management, mainly to talk to you about how to improve your immunity and your overall health. Obviously, these are some interesting times these days with COVID-19. Immunity is a big topic. I'll be talking about how you can do things the more natural way, reconnecting with nature. This does not require any pills or procedures to do. So this was me in my day job about a year ago. So in full PPE, even wearing the blue, black, and glasses at the time, and wearing lead right before going to the cath lab. This is when I was still doing more acute care cardiology. Now I'm focusing much more on heart attack and stroke prevention. So in August 2018, I started my own practice, Apollo Cardiology. The logo means something to me. The heart is in the center, and it's ringed by the sun because the sun is extremely beneficial for overall health. So I talk frequently about optimizing your circadian rhythms, optimizing your exposure to the sun at the right times of day. So we'll teach you a little bit more how to do those things today. So what's our agenda? A few things. One, I'll explain to you what biohacking actually is. Two, I will talk about circadian rhythms and how to optimize them. I'll talk to you about sleep quality, why it's important, how it helps improve your immunity. I'll talk about what the blue light hazard is, and then I'll talk about healthy sun exposure, also known as heliotherapy. We'll talk about the benefits of red light therapy, also known as low-level laser therapy and photobiomodulation. And if there's time, we'll also talk about heart rate variability, just a good metric for how stressed your system's under. And if you have a high stress system, your immune system doesn't work as well. So what is biohacking? This is Dave Asprey, the godfather of biohacking. This is his definition. I have one that's slightly different, but his definition is, biohacking is to change your environment outside of you and inside of you, so you have full control of your biology to allow you to upgrade your body, mind, and your life. A lot of words. I just like to simplify it to say that biohacking is health optimization. How do you change your environment to improve your overall health? So what is my mission? Mission 106 Plus. This was me. This was my great-grandmother, Ola. She was born in 1893. She passed away in 2000. This was her at her 106th birthday party. That's a lot of birthdays. She wasn't doing any biohacking, and she wasn't really even doing all that many healthy things. So I think I have a good chance of beating her if I do the biohacking. So this was my first foray into biohacking. This goes along with that first picture I showed on the intro slide. This was me flying over to Thailand initially. You can see it was a long flight, St. Louis to Chicago, Chicago to Hong Kong to Thailand. It's like a 14-hour flight. I was pretty concerned about how I was not going to die from all the jet lag. I did not understand all the science behind it, but found Asprey. He had written an article about wearing these funny colored glasses. So bought a pair of the glasses, wore them on the plane, did not understand why the glasses would work, but noticed that there's a tremendous decrease in my jet lag once I got to the other side. So bonus points if people know who the next guy is, and this is what I imagined other people on the plane thought I was, but I was not the Unabomber. Amazingly, the stewardesses and hostess, they didn't kick me off the plane. They let me sleep, let me do what I needed to do, and my jet lag wasn't so bad. This was me actually just in February this year, and I was already aware of COVID-19 at that point. I didn't necessarily know it was going to be as big a deal as it was, but I was wearing the blue, black, and glasses because planes have horrendous blue light, and it's very a toxic environment. The air isn't that good, and the viruses definitely can be airborne in the air. So I was prepared. This was kind of after I got back into biohacking. Once I got back to St. Louis, I came upon the technology that is now at Osteostrong through Dave Asprey's writings again. This was maybe 2 years ago or so at Laura and Johnny's place over in Creve Coeur, testing out the system. I do run the St. Louis Biohacking Club. Usually have a monthly meetup, kind of go through different topics. Many times it's light related because that's my topic of choice. But this time we went out to Oscarstrong to learn about the technology. This was me recently in January at a member event with Dr. Jack Cruz, who's one of the world's experts on mitochondrial health, but he's also what he calls himself as a mitochondriac. So he basically showed us, the day-to-day routines, what you need to do to optimize your mitochondrial health. The mitochondria are the things that make energy for you. So every morning, his whole group of people met out on the beach. We watched the sunrise, ate breakfast together. At nighttime, you didn't catch anybody without their blue blacking glasses on. Otherwise, you got a lecture too. So topic of choice today that we're really going to dive deep into is circadian rhythms. So circadian is basically about a day. So it's about a 24-hour cycle. So your body is programmed mainly by light that enters your eyes and the timing that meals come into your system. And different organ systems, different hormones, different biological processes happen at different times of the day. So going around the clock, wake up, say approximately 6 o'clock, your blood pressure is going to start rising as cortisol rises, your adrenaline level starts rising. You stop making melatonin because you start getting to get light into your eyes. You should likely have a bowel movement within an hour of seeing bright light in the morning time. Then you're most alert, 11 o'clock. But then, they asked me a little bit about exercise. I'm not an exercise physiologist, but if you want to, have your peak timing in exercise, probably want to do it in mid-afternoon. And then if you're going for big strength gains, probably about 5 o'clock. That's when your muscles are most primed to work hardest. Not saying that you can't work out in the morning, but if you want the best bang for the buck, that is the most optimal time to work out. Then your body temperature is higher in the evening time and starts dipping down, and that's a trigger for you to start going to sleep. Darkness then approaches, you start releasing melatonin, and we'll go through this whole story. The best book on the topic for beginners is The Circadian Code by Dr. Panda. This book is very well written, well researched, mainly explains how light enters your eyes, turns on these clocks, and there's different clocks in your gut and liver. Those get turned on more by the timing that the meals come in. So all the science is in there, but I'll explain what you actually need to do. So the main clock is in about the middle part of your head. It's about the size of a couple pieces of rice. It's called the supracosmatic nucleus, or SCN. As light enters your eye, it travels to this supracosmatic nucleus. It's basically like the body's master clock, or if you think about a GPS, satellite in the sky. It's what then sends the message to the body to keep regulating the time. Once the light enters the eye and hits the SCN and starts programming for the day, a whole cascade of hormones, neurotransmitters, and things start getting made. So what is light? Everybody's probably seen a rainbow. This was a lovely double rainbow in Puerto Rico a year or so ago, but it's just different spectrums of color. So there's different wavelengths. So is it really short or really long? So gamma rays, X-rays, those pass right through. Those can be damaging to the DNA, potentially cause cancer. Then there's UV radiation, visible light, infrared, and then radio waves. And so we'll talk a little bit later about radio waves, because this is some analogy that almost everybody would understand. Like an FM radio station and an AM radio station, you have to be dialed in exactly to a certain frequency to be able to hear it on your radio. Your mitochondria, your cells, are very similar to that. They need certain wavelengths to be turned on appropriately. That's important when we talk about heliotherapy and later the red light therapy. So the visible spectrum, it's a little less than 400 nanometers up to about the middle of the 700 nanometer range. So blue is more intense than green, yellow, red. And then sunlight. Sunlight varies throughout the day, also varies throughout the season, but we'll kind of do it from the day standpoint. So for optimal circadian programming, you'd wake up in darkness, you'd wake up around the sunrise. If you wake up before the sunrise, you would wear your blue blocking glasses to protect your eyes from the artificial light in your environment. You would see the morning sunrise without any glasses in front of your eyes, no contacts either. That sunlight hits your eye, programs that supracosmatic nucleus. In the morning time, there is no UV radiation, so you're not at risk of burning yourself, you're not at risk of damaging your eyes. In the morning time, there's visible light, and then shortly later, there's infrared A light, as well as I should say there's infrared light always, but a little bit later there's UVA light. That's what starts the process to dilate your blood vessels, also starts shutting off other hormone processes. By the middle of the day, UVB radiation's out. UVB radiation is what makes vitamin D on your skin. And later the vitamin D goes away, then later the UVA goes away, and then you just have visible light, and then it's very red at nighttime. That's kind of what this color is behind me. So not only is it the color of the light, it's the intensity of the light, the lux. So it's 1800 Kelvin in the morning time. It gets more intense and it gets very bright at nighttime. That intensity of the light also is a trigger to the eyes. So while you see something inside that looks bright enough to you, it may be only 200 to 300 lux. You're outside and you got like 10,000 lux. So it's an order of magnitude stronger. That brightness of the light triggers things to go on in your system. Even if it's cloudy like it is today, even if you can't see the sun, that light intensity programs things through your eyes on your surfaces of your skin. So what is the blue light hazard? Basically the light that comes from your technology. So you can see here, light from the sun, light from the blue light devices, blue lit devices, comes to your eyes, hits that circadian rhythm master clock, that supracosmatic nucleus. You end up making less melatonin. Melatonin is an extremely important hormone for sleep quality, but it's also a powerful antioxidant. It also helps basically program the mitochondria at night, or I should say it helps the mitochondria regenerate or recycle themselves at night. Without melatonin, you don't have good quality sleep and you don't repair yourself well. So it's a little bit similar, demographic, you get the bright white light from your artificial light, it destroys your ability to make melatonin and you don't sleep well. So I like this graph, kind of a seesaw, because melatonin and cortisol are really yoked like a seesaw. If cortisol is high, melatonin is low. If melatonin is high, cortisol is low. So what happens in the morning time, you go outside, you get the sun in your eyes, cortisol starts to rise. So the blue light from the Mother Nature, when it's balanced with red light, is healthy for you. You're supposed to have a rise of cortisol in the morning to get ready for the day. Provides blood sugar to your muscles, gets you ready to go, raises your blood pressure so you pump blood to your brain and your muscles. And in the evening time, naturally, the sun would set. Up until the late 1800s, you would have only had candlelight or oil lamps. You would not have had this intense bright light at night until they invented the light bulb. That darkness then starts allowing melatonin to get released from your pineal gland. You're making that melatonin all throughout the day, but it only gets released after about 3 to 4 hours of darkness. So what happens with the blue light? Well, it destroys the eye for one. It can thin out the retina, potentially cause cataracts, potentially cause retinal bleeding. It'll affect your hormones, affect your memory, may increase your risk of certain malignancies or cancers. Night shift work is associated with more malignancies because of the circadian rhythm mismatches, and definitely can play a role in people's issues with prediabetes, diabetes, insulin resistance, gaining weight. All your hormones get programmed incorrectly if you're getting the wrong colors of light into your eyes at the wrong times of day. So this is a good graph about what's the difference between our artificial lights and the way Mother Nature had it. That's coming in the next slide. But you can see that the newer LED bulbs that have only been out the past 5-10 years, are 6,000 Kelvin. That's very bright. And they have a big spike in the blue spectrum. That blue spectrum destroys melatonin, basically. 80% of the time, your melatonin levels go way down. Same with the compact fluorescents, the little curly bulbs. An old school incandescent bulb, the Edison bulbs, they were energy inefficient, giving off heat, but that heat was red light and infrared light. They don't suppress melatonin nearly as much. And then a candle doesn't suppress melatonin hardly at all, but doesn't put out a lot of lux or a lot of intensity of light. Just another way to look at it, you can see in top left is essentially what daylight is, where it's that full spectrum of blue, green, yellow, orange, red, and fairly balanced. Incandescent bulbs are about the nearest to what daylight was. But you can see that the fluorescents and the halogens, they all have big spikes usually in that blue spectrum. Same way with this, big spikes in that 400 to 450 nanometer spectrum with the artificial lighting. So heliotherapy, or using the sun for healing purposes, is something that goes back to the Egyptians and before. So it's only been in the past couple hundred years that people really started shying away from the sun. People tend to shy away from the sun way more than they abuse the sun. So I'm going to kind of show you how to use the sun more appropriately. So we'll talk a little about solar calluses and hybrid tanning. So much like your hands, if they don't work out much or you're not doing manual labor, your hands are nice and soft, and you start swinging a hammer around, lifting weights, it's going to take a while before you build up a callus on your skin. Same way with sun exposure. So if you're a pasty white person in St. Louis in the wintertime who spends 90% of the time indoors and then runs down to Mexico in January and misses the sunrise, wakes up late, goes outside at noon, and stays outside the rest of the day, they absolutely fry. Their skin is not preconditioned for that. So I'm going to teach you a little bit something about hybrid tanning. So I did a lot of this with Dr. Cruz down in Mexico in January, and I can tell you just from personal experience it works. There's probably never going to be a randomized controlled study that shows it works, but do your own due diligence. But if you do it slowly, you're not going to burn yourself. You're not going to get injured. So what hybrid tanning is essentially is you go out for that morning sunrise, take off as much clothes as you feel comfortable doing, and let that sunlight hit your skin. That sunlight does not have UV radiation in it, so you're not going to burn in the morning time. You're getting a lot of red light, that regenerative red light in the morning time. The sunlight is 42% red light. So your skin's soaking up all this red light in the morning, and then in mid-morning, the UVA and UVB radiation start coming out. So your body starts absorbing more UV radiation. You don't need all that much UV radiation. And then once the evening time comes around, sunset, ideally you go back out, get more red light. The UV radiation is gone. Your skin can start repairing itself. Basically, Mother Nature's photobiomodulation or low-level laser therapy. That's your red light box is the sun. So what do you do if you're getting too much sun? Physical blockers are always preferred. So a hat, long sleeve shirt, go hide in the shade. Basically follow what the animals are doing. If the animals are hiding out, that's what you should be doing. Ideally, you should be avoiding any type of sunscreen. Whatever you put on your skin is going to get absorbed into your system. So if you don't want to drink it or eat your sunscreen, you shouldn't be putting it on your skin. There are certain exceptions. If you're absolutely stuck out on the water for 12 hours and beating down sun, okay, wear some physical blockers, wear titanium-based sunscreens short term. But you don't want to always be blocking the sun because your body needs certain wavelengths of light, those certain frequencies to turn on certain hormones. There's an app we'll show you in just a minute called D-Minder. It's free. At least there's a free version of it that works just as well as the paid version. I'll show you about that in a moment. The other thing that really helps you not burn is optimizing your omega-3 content. So basically the DHA that's found in seafood. If you get an omega-6 to omega-3 ratio, which you can get on an advanced blood work panel, optimally be under 4, so you only have 4 times as much omega-6 as omega-3, you're much less likely to burn. If your ratio is like 15 to 1 or 20 to 1, like some of my patients, you're much more prone to burn when you're in the sun. And then optimally, how do you know you're getting enough sun? You want a vitamin D level, optimally at least 50 to 60 without taking a vitamin D pill. Vitamin D is a hormone. Your body makes hormones based off what's going on in the environment. Taking a pill is like asking somebody else to do the work for you. Your body doesn't know where that hormone came from at that time. So if you're supplementing with oral vitamin D, I'm not telling you to stop it. Talk with your doctor or healthcare provider who told you to take it in the first place. But you still need natural sunlight to activate the vitamin D that you're taking orally. And an important thing about vitamin D is it's a good surrogate for your innate immune system. You have an innate and an adaptive immune system. Your innate immune system is essentially your built-in immunity. So if you have optimal vitamin D levels, your immune system tends to work better. So I think if certain hospitals are starting to check people with COVID-19 what their vitamin D levels are, it will not be surprising that people with low vitamin D levels tend to get more severe cases of this virus. This is highly likely the reason why African Americans are having such a disproportionate number of infections and disproportionate number of deaths with COVID-19 is low vitamin D, low innate immunity. The UV index is just a marker of how intense the UV light is and how much time you need to be outside before you can start burning. So this just gives you a ballpark estimate, how much, people always ask me, well, how much time do you need to spend outside, Dr. Conlon? As much as possible. You were born to be outside. 90% of your time optimally should be outside. Everybody flip-flops and spends 90% of their time inside. Does not mean you need to be sitting out there in full-on UV radiation all day long. You can hide under a canopy, you can wear physical blockers, hats, and stuff like that. But if you have a high UV index day, you only need 15, 20 minutes of light before you get your dose of UV radiation for the day. So here are some color changing beads. I actually have it sitting right in front of me right now. You can see it's white because there's no UV radiation inside normally. So these color changing beads change when UVA radiation is present. So sometimes I'll wear this when I'm outside, especially on a cloudy day, and it'll still turn purple. So it lets you know that the UVA radiation, still some of it gets through the clouds. If it turns white, then you know the UVA radiation went away. And if you see me in the office, I frequently comment on this app. It's probably one of my favorite prescriptive apps for people to get, called D-Minder. Just lets you know what time of day to be outside to optimize your vitamin D exposure. So it tells you what time of day that you can start making vitamin D. I'll just use an example in St. Louis. And then also tells you, there's another feature in that will show you what days of the year you actually can make vitamin D. There's about a 2-month vitamin D winter in St. Louis where even if you're going outside with no clothes on, you're not going to make any vitamin D on your skin. So this app will tell you where you can make vitamin D. It gives you the UV index. It'll tell you when solar noon is. So solar noon is when the highest intensity of UV light is. So you probably don't need that much sunlight at that point. That you dial in essentially how much cloudiness you would see. That's not automatic. You got to kind of do that your own. And then you got to tell it how much skin you have in the game. So if you're just face exposed, you only got 10% of your body exposed. You're just wearing shorts and nothing else, you got about 80% of your body exposed. Your body's a solar panel. The more sunlight you put out there, the more skin you put out there, the bigger the solar panel, the more you can absorb, the less time you need to be outside. This will actually tell you how many units of vitamin D you're making a minute. And so for many of you who may be taking vitamin D supplements, you're taking 1,000, 2,000, 5,000 IUs a day. You can see this person, in this example, was making 162 units per minute. So you can see it does not take a long time to get 5,000 units a day if there's high UV radiation. So this will help you do it safely. Next, we'll transition to talking about sleep. Sleep is kind of the master determinant of longevity and health. Sleep is when your body repairs itself, and it's very tied into your circadian rhythms. So your mitochondria, things that make energy for you, they repair themselves at nighttime. There's 2 things called autophagy and apoptosis. Autophagy means they recycle themselves. So the ones that aren't working well, they try to take out the parts that work. And apoptosis is cell death. The ones that don't work well, they get rid of them. So what I usually recommend patients consider doing is setting up a sleep sanctuary or quote sleep cave. Essentially, you want to go to a place where you know it's going to be a place of rest and recovery. So your bedroom should be for 2 things only. It should be for sleep, or if you're trying to have a 9 months from now, a quarantine baby or something like that, go for that. But otherwise, just focus on recovery when you're in your bedroom. So how do you do that? You set it up to be dark, cool, quiet, and minimize tech. So dark that you can't see your hand in front of your face is ideal. Cool, 68 degrees or cooler. Quiet, you can use a white noise machine or a fan, that's not a problem. But you don't want to be falling asleep to TV. You get a double whammy with that. You get a ton of blue light from the technology, and then the noise from the TV potentially reprograms your subconscious, put your mind at a higher state of anxiety. You don't need to be hearing words while you're sleeping. And then I already talked about minimizing the tech. Next picture is awesome. So I do not have this. This is not my house, but I was just searching for an example of a blackout curtain, and literally this was the first thing that was there. So for those that know, they know. But blackout curtains for if you're sleeping during the daytime, or you have a lot of halogen lights outside, street lights coming in through your windows, get a nice pair of blackout curtains. Make your room as dark as possible. If you're a true biohacker, consider investing in one of these things, the chili pad. Ideally, I try to open the windows when I can, but if I can't do that, I dial up my air conditioning, probably 68 usually most days, but sometimes it's still too hot, so I have a chili pad. The chili pad has dual zones, so you can dial in different temperatures, 55 degrees up to 105 degrees, I believe. So I slept on it at 55 degrees once. It was extremely cold. I could not tolerate it. So I think I woke up in the middle of the night on the other side of the bed. So I usually set mine at 66 degrees or so. already talked about this a little bit about minimize technology, but this is the no Wi-Fi. So at nighttime, your body's there to recover. You don't need a lot of technology in your environment. The technology can basically act as radar jammers to your body, sensing the environment. So your mitochondria are very sensitive to electromagnetic frequencies or EMFs. Wi-Fi is an EMF. It's light, just light that you can't see, but that light still hits your body and impacts it. So what can you do? I have a Wi-Fi router plugged into a power strip that also has a lamp attached to it. If that lamp is on, then I know my Wi-Fi is on. So at night, flip the switch, the Wi-Fi goes off. So sleep in a Wi-Fi free zone. Phones, they need to be ideally out of your bedroom, but if they're going to be in your bedroom, the first thing to do if you can is put it in airplane mode so that none of the radio frequency devices are on. The radio frequency from the cell towers and the Wi-Fi router or the Wi-Fi signal transmitter in your phone is shut off too. So in airplane mode, turns both those off. Or if your phone absolutely must be in your room, you want to put it as absolutely far away as possible from you because it acts like a radar jammer. I've seen it clinically that people have had nightmares because they were using their phone as their alarm clock, sitting right by their head. They got the phone out of the room, the nightmares went away. I've seen it more than once. So shut off your phones, get it away from your body at nighttime. This sometimes leads into the sleep trackers. I've tried a couple of them. I won't name them. I'm not paid by any of these people to rep their devices or anything like that, but I've tried a couple of different sleep devices. Honestly, I'm not a huge fan of them right now. If you need to use it just to get a good idea of what's going on with your sleep, use it for short term. But after that, your best answer is when you wake up in the morning, do you feel rested? The answer is yes, you're probably good to go. Give yourself a scale of 1 to 10, how well you feel. If you feel you got to pound caffeine all morning long to stay awake, then you didn't sleep very well and figure out what's causing you to not sleep well. If you feel like you're going to take a nap by 11 a.m., you did something wrong with your sleep environment, probably. So focus on fixing your environment first before, worrying too much about sleeping, 4 hours and 10 minutes with REM sleep and all that stuff. The reason I say that is that those sleep trackers do have low levels of electromagnetic frequencies. Again, they're like radar jammers to your cells. So I don't personally wear anything electronic on me when I sleep. I've already talked a little bit about this, but minimizing blue light. Kind of go into a little bit of show and tell here for a second. So if you see me in the office, I'm always wearing some type of blue blocking lens. These particular lenses block between 400 and 465 nanometers. Again, like I said, frequency matters. So not all blue blockers are made the same. Typically, once the evening time comes around, I will switch out and wear the red lenses. Sometimes I wear this during the day if I'm in front of a lot of technology. These red lenses block all the blue light, all the green light. Basically starts telling your brain, it is midnight. You should be going to sleep soon. So melatonin levels start building up if you wear these ones. People ask me, what should I do if I have to wear prescription glasses? There's companies that make glasses that, kind of like the cataract glasses or the Ray Charles glasses. You put them over your prescription glasses and they work just as well. For your computer, I tend to run the Iris software. There's a little bit more customizable. There's a free version of the Flux. It just basically dials out a lot of that blue spectrum of light from your technology. You can set it automatically to your geolocation. So once the sun sets in your location, your computer screen starts turning more orange. That lux and intensity starts going down. On your phone, there's night shift. People ask me, is that sufficient? No, because there's still a significant amount of blue light coming from it. You still have to wear your glasses. It's just a good start. Next, transition into red light therapy. The medical terms are low-level laser therapy or low light level therapy. The other name for it is photobiomodulation. Photo light, biology, modulation, change. So these are some Juve panels this person's standing in front of. Juve is just one manufacturer of the red light boxes. I actually do have their Juve. That's pretty funny, goes away because of the screen. If I put it on my face, it won't. But I have the small Juve Go, it's portable. And I'm not repping them, I'm not paid by Juve to talk about them, but sometimes I'll travel with that one and use it to kind of light up a room. But the best way to think about what red light therapy does is it recharges your batteries. It recharges the mitochondria, the water in the mitochondria. There's multiple studies that explain the benefits of red light therapy, but these are probably the top 10 or so. It lowers inflammation. Inflammation is your immune system turned on and staying on. You want your immune system turned on when you have an infection, but you don't want your immune system turned on all the time because there's just more risk that things will get damaged. Helps treat arthritis, joint injuries, and swelling. The red light therapy lowers that. It can improve hypothyroidism or underactive thyroid. Your thyroid sits, right in the middle part of your neck. And when we're conversing on these technology with blue light, that blue light can penetrate your neck and can actually stimulate certain antibodies towards your thyroid. So if you have Hashimoto's or autoimmune thyroiditis, when you're in front of a computer, you ideally should be covering up your neck. When you're outside, more sunlight to your neck. The other thing you can do to biohack it is use a red light therapy on your neck, may help with your hypothyroidism. This is the battery part, improving performance and cellular energy. You'll have shorter recovery time because it's lowering inflammation, lowering swelling. It can improve testosterone. You can imagine how you use that. There's a sort of famous biohacker on the internet. You go to searching for red light therapy and testosterone improvement, you'll find it. But essentially, if you shine the red light where testosterone is made, you can boost your testosterone levels. You can also do that with natural sunlight. It's going to improve your skin health and improve loose skin because it's stimulating collagen. It smooths things out. It can improve oral health, so potentially it helps with gingivitis, and then hair loss. So there are laser helmets people can wear that stimulate the mitochondria in the hair cells and starts growing hair follicles. So you hear me keep mentioning the word mitochondria. This is a blurb of what one would look like. Mitochondria used to be bacteria that our cells took up millions of years ago and became symbiotic. So we give them a home and they make energy for us. That's kind of the trade-off. But the mitochondria, that's about where 80% or so of all chronic diseases happen. If your mitochondria break, wherever they break, that's where you get disease. So if they break in your heart, you get heart disease. Break in your brain, you get Alzheimer's, Parkinson's. Breaks in your immune system, you get an autoimmune condition. Complicated slide, which I'm not going to go fully through, but essentially this is the respiratory chain. This is how food actually gets broken down in your system. It gets broken down into protons, the H's, and electrons, the negatives, and it goes through this respiratory chain. As the electrons get passed off, they basically transfer energy to different substances, and at the end, you see this blue thing. It's called the ATPase. It's like a little top that spins. The faster it spins, the more energy comes out of it. Red light therapy stimulates the 4-cytochrome. It basically is a red light chromophore, meaning that red light turns it on. So how does this work? So without even putting food in the system, if you use sunlight, it works. You use one of these red light boxes, it works. It stimulates this cytochrome 4. You're basically going to make energy in that part of the cell without having to put food energy into it. And then you'll spin that ATPase faster. So you're getting more energy without having to put more food in the system. So next time, if you're fortunate enough to ever travel again, is the next time you're on the beach, notice if you're hungry. Most people are not nearly as hungry when they're on vacation, on the beach vacation, when they got their feet planted in the sand, they're earthing and grounding, they're getting basically free electrons from the earth, and they're tied into Mother Nature via the sun. That sun is stimulating your cells to make energy without food. So most people will feel that they only need to eat 1 or 2 meals a day when they're on a beach vacation. That's why. So as I mentioned earlier about AM and FM radios, frequency does matter. And again, with the red light therapy, frequency does matter. There's hundreds and thousands of scientific journals with photobiomodulation, and different wavelengths do different things. A lot of the data is in that 660 nanometer range, but there's ones up into the 800 nanometer range. So frequency does matter. So definitely need to read the label or talk to the manufacturer of your red light box. But the things that determine if the therapy is actually going to work is the wavelengths, which we just talked about. The second thing is going to be the power density, or how intense the thing is, and then the adequate dose. How close are you standing to the red light box, and how much do the cells actually suck up of this red light? So this is why just using a red light bulb is not photobiomodulation, because it's not intense enough, and it's probably the wrong wavelength. So you need to know what you're doing with these things. This is a schematic of how deep the different wavelengths of light penetrate. So UV and blue light don't penetrate the skin very much at all, but the red light, the near infrared light, that gets in deeper. The near infrared ultimately gets into the like the heating elements, so that's when People are doing like a dry sauna or an infrared sauna. That infrared helps with inflammation, muscle pain, and such, but it's not necessarily stimulating energy in the mitochondria. That's mostly the red light therapy is. I just had this up because I spoke to this one gentleman, and he actually ended up using one of my quotes in one of his posts on Instagram. But approximately 1/3 of your heart by weight is mitochondria. So this is what I'd recommend if anybody has any heart issues. Ideally, use Mother Nature's sunlight hitting your chest. That helps stimulate those ATPases in the heart cells. But if you're indoors, red light therapy right over the chest. How much? 20 minutes twice a day, maybe an hour. Depends on how bad the heart issues are. Laser watch. This is advanced biohacking, and honestly, I'm actually wearing one right now. This is a watch that actually has 4 different wavelengths of light. It has red, yellow, green, and blue. They do different things. Mostly focus on the red. So this is putting red light into my radial and ulnar artery, basically stimulating my blood as it flows through the system. So this is a kind of upgrade from just standing in front of a panel. And then if you want to go for the ultimate red light therapy, you go IV. This is not for everybody. This is definitely advanced. And for just overall healthy people, not a lot of great benefit to go out and do this, but I wanted to try it anyway. I was doing a Myers cocktail as a high dose vitamin C, and somebody asked me, did I want to try the red laser? I'm like, yes, I do. But red lasers into the IV, there's a lot of data from the 80s from the Russian scientists that this does treat certain cardiovascular conditions. Because of the Cold War, all that scientific data stayed over there for a long time, and only now is kind of getting reassessed and brought into even clinical practice in the US. But different wavelengths of light into the venous system mostly would benefit people with malignancies, cancers, or autoimmune conditions. It can help stimulate the cells more effectively. And lastly, we'll just end on heart rate variability. I've spoken about this before. But heart rate variability is a good measurement of how stressed your body is. And the more stressed your body is, the less your immune system is working well at that time. So if you measure your heart rate variability every day and get a baseline, you'll know if you're more susceptible to you'll know you're more susceptible to not only SARS-CoV-2, but influenza and all types of infections. So what is heart rate variability? It's the beat to beat difference between each heartbeat. So it's not like it's a metronome where everything is the same. It should contract and expand as you're breathing in and out. The further it expands and contracts, the more variable it is. If you have high heart rate variability, you're less physiologically stressed, you're ready to go. You can work out harder at home. You can work out harder out in the park. Not at the gym unless you got your own home gym. The lower your heart rate variability, the more stressed you're under. You should likely take a deload day. You should not be pushing yourself as hard that day. You need to recover more. These are just some screenshots of the 2 apps I use. I use 2 different apps. I'm playing around with both of them right now. They give different data. One of them I'm using is using a Zoom watch. Sorry, this is going in and out. Maybe I'll pull it back here. But basically, a watch goes on and syncs to an app to your phone. It takes actually takes 3 minutes to take a measurement. You do it first thing in the morning before you do anything else, really. Get your resting heart rate and your heart rate variability, and just watch it throughout the week and see if things are changing. If it's low, don't push it hard that day. The other one that I use is called Elite HRV. Gives you a whole lot more data. Now, if you're a data nerd, you'll like all this stuff, but otherwise, sometimes it's overkill. But essentially, you can really fine tune what's going on with your stress levels if you look at all these kind of numbers. And what can you do about if you're under a lot of stress? Well, try to get some better sleep if you can. But in real time, what you can do is you can do heart math. Again, not paid to talk about them, but I just like it. But it helps achieve this balance between your brain and your heart, helps rebalance that sympathetic parasympathetic tone. That sympathetic tone is your fight or flight response. Parasympathetic tone is your rest and relaxation. So what's it do? It clips to your ear. Looks like a little pulse ox, clips to your ear, measures your heart rate through your earlobe. And if your heart rate and heart rate variability are nice and doing well, you go into the green zone. If it's all jaggedy because you're under a lot of stress, you're gonna be in the red zone. There's different breathing exercises that put you through, and doing these breathing exercises, you can get that thing back into the green. 5 minutes a day for 4 to 6 weeks really helps bring down your stress levels, helps you sleep better. If you're anxious, have high blood pressure, there's data that it helps those things as well. So I think that's my, not last slide. So some resources, I already mentioned one, the Circadian Code by Dr. Panda. Another good book called Chasing the Sun goes through all these reasons why heliotherapy was beneficial, previously used for all sorts of infectious diseases. There's actually, not in this book, but there's an article I posted on my Facebook group right when this COVID-19 thing was really getting popular to talk about, was in 1918 flu, the patients that tended to do better were the ones that were outside, because the hospitals got overwhelmed. They had field hospitals in Massachusetts and Boston, and the outside people tended to do better, probably because there's fresh air kind of blowing the viruses away. There's also the UV radiation was killing the bugs, but also UV radiation was improving the vitamin D statuses of those people. And then if you really want to go down the deep rabbit hole, this is the Bible book for How Light Affects Health by Roland Van Wyck. Light and Shaping Life, Biophotons in Biology and Medicine. And I'm not kidding, this was the hardest book I read since I left medical school, harder than any cardiology book I've ever read, because it's really deep into the science of how light interacts with life. But if you really want to go deep, this is the book for you. So I'm going to end it here with the presentation. I do thank you guys for your attention. I will open up to Q&A. If you're interested in knowing more about my practice, I work with Apollo Cardiology. One website I have is called heartattackpreventionexpert.com. If you click the link there, I do have a free resource that goes through some of these circadian rhythm management things, other things you can do to look at your heart health. I'm most active on social media on Instagram at Dr. Twyman. I'm actually on Instagram Live right now and streaming it. And then I do have a free Facebook group if you're interested called Dr. Twyman's Tribe, Heart Attack Proof. I post articles there routinely, interact with people, hold them accountable to their health goals. So that's the places you mostly can find me. So I'm going to stop sharing my screen for a moment and then open it back up to a Q&A. All right. So, oops. So I think since Laura's the host, you can just make sure that people can unmute themselves if they would like to unmute themselves. There is also a chat box that you can type any questions in.
So I know this is Jason over at OsteoStrong in Clayton. So first of all, thank you for all the information and for spending the time going through all this. I know it was really helpful for me. One question that I get on a regular basis is how long do you need to use like red light therapy, and like how long can you start to see the effects of some of the different biohacks and the different tools that we use to improve our health like this?
It's a great question, and it comes down to those three things: is what wavelengths of light are being used, what is the power density, and what is the dosage. You know, a rough estimate, it's going to be 20 minutes once or twice a day to whatever affected area that you want to be treating. So if you have a bum knee, 20 minutes twice a day to it's probably optimal. There is a kind of a part where you're not necessarily going to hurt yourself with it, but you have diminishing returns, and you might actually start taking away some of the gains. So too many people think a little is good and more is better. That's not necessarily the case with red light therapy. If you overdo it, you basically just won't get the gains that you're using it. So rough estimates, 20 minutes twice a day, but it's dependent on each light manufacturer, and most of their websites have kind of FAQ answer says, okay, if you're treating this, this is about how long you'd want to use it for.
Awesome, thank you.
Sure. Got a question, can I go over my glasses and what we need to look for to buy them? Sure. So again, I'm not paid to recommend any of these glasses. I purchased them all on my own, but wavelengths matter. So it's the example of the FM and AM radio. If you don't have the right wavelength, you're not going to get the right station. So a lot of the stuff that you see just on Amazon, say blue blockers or computer glasses, not saying they really don't do that, but they're not blocking all the right wavelengths that you need to block. So I really only recommend 3 manufacturers of the glasses. There's a fourth one if you have prescription glasses. If you want prescription glasses, that's Blue Tech lenses. There's different manufacturers in St. Louis that could do that. It's very pricey to get a custom made of blue blocker glasses. But And honestly, I don't necessarily recommend it because if you really can't see well and you have to wear these glasses all day long and you go out in the sun and you have quote blue blockers on, then you're filtering out natural sunlight into your eyes and your eyes don't get that blue light they naturally should have gotten. So if you're going to wear prescription blue blockers outside, you need to tip your glasses down so natural sunlight gets in your eye. There is case reports of people getting depression because they kept wearing these prescription blue blockers outside. They never got that blue light in their eye. They didn't make all the hormones their body needed to not be sad. So be careful if you have prescription blue blockers. But the ones that are not prescription, or you can just wear them over prescription, current ones I'm wearing are RA Optics, RA Optics. These are the day ones I wear. I also wear their red tinted lenses approximately an hour before bedtime. But if I'm trying to improve jet lag, I'll wear these at different times of day when I'm flying somewhere based off what the local time zone is where I'd be flying to. The other manufacturer makes a good one. It's called Blue Blocks, BLUBLOX. They're a company out of Australia, make good glasses. The only side effect is if you have an issue with the way it fits and you got to ship it back to Australia, it just takes a while to ship back and forth, but they have very good customer service. Their frames tend to fit some people better than the RA Optics ones do. And then the third one, I say it is third, and my preference would be the True Dark ones. These ones I started off with, but the technology's gotten better than what they currently have. But the ones I mostly like for True Dark are they're kind of fit over ones that just fit over anybody's prescription glasses. And I got a question on Facebook. Will this be available to view later? Yes, I'm recording it on Zoom. I'll put that up on YouTube, and it's recording on Facebook. So hopefully it'll stay in the Facebook group.
Okay, any other questions?
There has to be questions.
Well, if not, just let me take a moment to thank you again for talking to us today. I mean, it's really great. I know I've met you in person, and there's just a whole lot of information that you can share. So hopefully we'll get a chance to do this again. Laura Harper from OsteoStrong and Creve Core and Telegraph, thank you for coordinating this. Thank you for everybody for showing up. Again, Dr. Twyman with Apollo Cardiology over in Clayton. It was great to have you today. So we really appreciate it.
You're very welcome. Well, thank you everybody for your attention. And again, if you need me, I'm all over the social media, Dr. Twyman on Instagram, Facebook groups, it's called Dr. Twyman's Tribe. I have a YouTube channel. It's now Michael Twyman MD. So all these videos, they'll be up on my YouTube channel later today.
That's awesome. Thank you so much.
You're very welcome, guys. Have a good one and stay safe.
All right. Take care.
Yeah. Bye-bye.